Hello everyone, welcome to my channel The Courageous Nurses. So we are going to discuss about cataract today. So let's start with the introduction first. Here it is written, a cataract is a lens opacity or cloudiness. That means because of cataract, the lens, it will not be transparent. The surrounding, it will become hazy, and because of which the person will not be able to see the environment clearly. And it is written, cataracts rank behind only arthritis and heart disease as a leading cause of disability in older adults. Cataracts affect nearly 20.5 million Americans who are above 40 years of age or older, or about 1 in 6 people in this age range. By 80 years of age, more than half of all Americans have cataracts. According to World Health Organization, cataract is the leading cause of blindness in the world if proper treatment is not taken by the person. Coming to the various causes of our cataract, first one is aging, in which we have got the various subtopics. That is your loss of lens transparency. That means the lens will be hazy. Clumping or aggregation of lens protein. That means there will be accumulation of your lens protein. What it will do? It will lead to light scattering. Again, accumulation of a yellow-brown pigment due to the breakdown of your lens protein. Decreased oxygen uptake, increase in sodium and calcium, decrease in levels of vitamin C, protein and glutathione and antioxidant. With the aging, there will be these kind of problems which will be seen in the patient. Associated ocular condition. In such ocular condition, in eye condition, we can see the cataract. That can be a complication of these kind of diseases like your retinitis pigmentosa. That means there will be damage of the retina, the inner layer of the eye, it will be damaged. So that is called your retinitis pigmentosa. Myopia, it is your nearsightedness. The people who have got myopia, they are more prone to get cataract. Retinal detachment and retinal surgery. Patient who have got retinal detachment and who have gone through retinal surgery, they might have cataract. Then patient who are infected with herpes zoster or uveitis can have cataract. Coming to the toxic factors, corticosteroids, especially at high doses and in long-term use, alkaline chemical eye burns or any kind of poisoning to the eyes, cigarette smoking, calcium, copper, iron, gold, silver and mercury, which tend to deposit in the pupillary area of the lens. They can lead to your cataract. Then nutritional factors, reduced level of antioxidants and poor nutrition and obesity of the person. Physical factors, dehydration associated with chronic diarrhea, use of purgatives or laxatives in anorexia nervosa, and use of hyperbaric oxygenation. Now, what is your laxative? It is a type of medicine that helps to empty bowels when the person is not able to do so due to constipation especially. And what is anorexia nervosa? We know that it is a eating disorder in people who are obsessed with their weight and what they eat. So they have a kind of fear that of eating something they will become overweight even if they are very much lean. So this is a kind of condition when the person they consume a lot of laxative. Now what is your hyperbaric oxygenation? Hyperbaric oxygenation, it is a breathing of pure oxygen in a very pressurized environment. For example, in case of your scuba diving. Okay, now we will see the other subtopics like your blunt trauma, perforation of the lens with a sharp object or foreign body, electric shock, ultraviolet radiation in sunlight and X-ray. Now coming to the systemic diseases and syndromes like diabetes mellitus, Down syndrome, disorders related to lipid metabolism, renal disorders and musculoskeletal disorders. So these are the various kind of your causes for your cataract. Looking into the pathophysiology of cataract, cataracts can develop in one or both eyes at any age as a result of a variety of causes which we have already gone through in previous slides. The recent studies they have linked cataract risk is lower in lower income and lower educational level, and smoking for 35 or more pack a year can increase the risk of cataract as well as high triglyceride levels in men. Then three most common types of senile age-related cataracts are defined by their location in the lens. That is a nuclear, cortical and posterior subcapsular. The extent of your visual impairment, it mainly depends in their size, density and location in the lens. More than one type can be present in one eye. A nuclear cataract is caused by central opacity in the lens and has a substantial genetic component. It is mainly associated with your myopia, which worsens when the cataract it progresses. If dense, the cataract severely blurs your vision. Periodic changes in prescription eyeglasses help manage this condition. In case of cortical cataract, it involves the anterior, posterior, or equatorial cortex of the lens. A cataract is the equator or periphery of passage of the cortex, does not interfere with the light through the center of the lens, and has little effect on vision. Your cortical cataracts progress at a highly variable rate. Vision is worse in very bright light. People with the highest level of sunlight exposure have twice the risk of developing cortical cataracts as compared to those who are exposed to low level of sunlight. Now coming to posterior subcapsular cataracts, it occurs in front of the posterior capsule. This type of typically develops in younger people, and in some cases it is associated with prolonged corticosteroid use, diabetes and ocular trauma. Near vision is diminished and the eye is increasingly sensitive to glare from bright eye, example in sunlight and headlights. Your Caucasians, that is your white people, are more likely to develop nuclear and posterior subcapsular cataracts as compared to cortical cataracts, which is more prevalent in your African American, or we can say the people who are color is black. Various clinical manifestations like your painless, blurry vision is characteristic of your cataract. Person perceives the surroundings are dimmer as if his or her glasses need cleaning. Light scattering is common, and the person experiences reduced contrast sensitivity, sensitivity to glare and reduced visual acuity. Like other effects like your myopic shift, astigmatism, monocular diplopia, that is your double lens become vision. Color shift, brucines, reduce light transmission. Your brucines is your color value shift to yellow brown. Okay, so these are the various clinical manifestation which we can see in cataract. The kind of assessment we do for diagnostic finding, yes, we do the history taking and physical examination. Then we also go for Snellen visual acuity test, ophthalmoscopy we will use, and slit lamp biomicroscopic examination will be also done. To know it in a better way, I have already uploaded diagnostic tool for eye checkup, so you can go through that slide. Talking about the medical management, there is no non-surgical treatment which will cure your cataract or prevents age-related cataracts. But yes, we can give the medication like eye drops and eyeglasses they can use, but it will not be cured until we go for a surgical management. Results from the age-related eye disease study research group, a randomized placebo-controlled trial found no benefit from antioxidant supplements like your vitamin C and E, beta-carotene and selenium. Results of studies that have attempted to determine the possible benefit of a once-a-day multivitamin supplement to prevent or delay the onset of cataracts have been mixed. In the early stages of cataract development, glasses, contact lenses, strong bifocals, magnifying lenses may improve your vision. Talking about the surgical management, mainly we have two types of surgical management, that is your lens replacement and phacoemulsification. In case of phacoemulsification, in this method of extracapsular cataract surgery, a portion of the anterior capsule is removed, allowing extraction of the lens, nucleus and cortex, while the posterior capsule and zonal support are left intact. It is done with the use of ultrasonic device which will be used to liquefy the nucleus and cortex, which are then suctioned out through a tube. That means the lens will be broken down into pieces, and with the help of a tube, it will be suctioned out through the from the eyes which is affected. In case of your lens replacement, after removal of the crystalline lens, the patient is referred to as aphakic, that is without lens. The person is without lens. The lens which focuses the light on the retina, it must be replaced for the patient to see clearly, have a clear vision. So there are mainly three lens replacement options. First one is the aphakic eyeglasses, second one is the contact lenses, and third one is your intraocular lens implants. In case of your aphakic glasses, although it is very much effective, but it is rarely used. Why? Because objects are magnified by 25%. That means it makes them appear closer than they usually are. This magnification, it creates distortion, especially when the person's other eye is normal. Okay, so we can also go for contact lenses, but contact lenses are also not advised for patients who have difficulty inserting, removing and cleaning them timely or properly. Frequent handling and improper disinfection increase the risk of infection to the eyes. So insertion of intraocular lens, that is the third type, during cataract surgery is the usual approach to lens replacement. After cataract extraction or phacoemulsification, which we have studied earlier, the surgeon implants an intraocular lens directly. Cataract extraction and posterior chamber IOLs are associated with a relatively low incidence of complication like your hyphema, macular edema, secondary glaucoma, damage to the corneal endothelium. Intraocular implantation is contraindicated in patients with recurrent uveitis, proliferative diabetes retinopathy, and neovascular glaucoma. As we are nurses, so we should also see the nursing management. In nursing management, we have got the nursing diagnosis. I have written 3, but you can write more for such kind of cases. First one is your disturbed sensory perception related to poor visual acuity as evidenced by loss of vision, visual distortion. Second is your anxiety related to treatment modalities as evidenced by frequent cautioning, tensed look. Third, risk for injury related to visual disturbances as evidenced by difficulty in identifying objects nearby. Complications of cataracts, it is mainly divided into 3 types. The operative complication. In operative, we have vitreous loss, posterior loss of lens fragments, suprachoroidal hemorrhage or expulsive hemorrhage. In case of early post-operative complication, we have got iris prolapse, striate keratopathy. Striate keratopathy, it is a form of your corneal edema. In case of acute bacterial endophthalmitis, it is a type of inflammation of the inner courts of the eye, which has result from the intraocular colonization of infectious agents. That means there is an accumulation of infectious agents which has led to exudation, and because of which the intraocular fluid has increased and there is also infection. Then in case of late post-operative complication, we have got capsular opacification, implant displacement, corneal decompensation, retinal detachment, and chronic bacterial endophthalmitis. Hope this video was helpful to you. Thank you for watching my video. Do like, share and subscribe my channel, The Courageous Nurses. Thank you.